This practice is a breathing exercise which can be helpful for bladder incontinence. And a study I read about this, I actually was reading about this exercise and thought, oh, I can really kind of weave in the Qigong breathing to this. This study was showing how breathing exercises and just calming the mind and calming the nervous system can really help with the improvement of bladder health and improving the condition of urinary incontinence. And I think it said in this report that people who practice this simple exercise for twice a day for 5 minutes each time over the course of 2 weeks noticed a difference in the urgency or the frequency of wanting to run off to the loo. I think it reduced from something like 42 times in a week down to 16 times in a week. So people were kind of logging how, that urgency to go. So it's definitely worth pursuing some breathing exercises to help to calm everything down, because bladder incontinence is often kind of geared around and exacerbated by stress and anxiety. So if we calm our minds by using some breathing, then that can really help. So you can practice this exercise either from a sitting position, as I am just now, sitting cross-legged, or sitting on a chair. Just make sure the back is up, your back is upright. Or you can practice it from a lying down position. If you'd like to lie down, I'll just show you that position now. So I've got a little blanket or a pillow here for my head, and then just coming around to the side with my knees bent, just lowering myself, using my hands, just lowering myself gently down to the ground. And then adjusting my body so that I have I've got the pillow just in under the head. My chin is tucked back towards my throat. So there's lovely length in the back of the neck and coming out to the top of the head. And from this position, you can either have your knees bent, feet flat on the floor. If so, the knees would be around hip width distance apart, or you can move the feet wider apart and allow the knees to fall in and touch each other. We covered this lying down position in the previous class last week, so you might want to refer back to the replay of that video on my blog page. You could also have the legs straight out in front of you if you prefer that, and maybe have a blanket or a bolster underneath your knees, whichever you prefer. So I'm going to take the pressure off my lower back just by having the knees bent and relaxing the knees back in towards each other. And I've got my hands just on my lower belly, and practicing the abdominal breathing in through the nose, feeling the belly expand. So you'll feel the hands coming up, rising up towards the ceiling if you're lying down for this position. And then exhaling, feeling the hands and the belly sink back down towards the floor and your spine. So breathing in and breathing out. And each time you breathe out, thinking of your body melting into the floor, getting heavier, releasing any tension. So breathing in, hands rise, breathing out, melting into the floor. And we're going to use a couple of techniques with this breath. We're going to use some counting, and we're also going to use our mind and pay very gentle attention, no laser beam focus, otherwise you'll give yourself a headache, but gently observing the kidneys in the lower back, thinking of the bladder and the pelvic floor. So your mind is just in those areas. You're not moving them, you're not contracting anything, you're just bringing your mind to those areas. And now breathing in for the count of 3 and out for the count of 3 for 3 breaths. So when we're ready, breathing in, 1, 2, 3. Breathing out, 1, 2, 3. Breathing in, 1, 2, 3. Breathing out. 1, 2, 3. Breathing in. 1, 2, 3. Breathing out. 1, 2, 3. Now for the count of 4. Breathing in. 1, 2, 3, 4. Breathing out. 1, 2, 3, 4. Breathing in. 1, 2, 3, 4. Breathing out. 1, 2, 3, 4. Breathing in. 1, 2, 3, 4. Breathing out. 1, 2, 3, 4. And now for 5. Breathing in. 1, 2, 3, 4, 5. Breathing out. 1, 2, 3, 4, 5. Thinking of the kidneys. Breathing in. 1, 2, 3, 4, 5. Breathing out. Thinking of the bladder. 1, 2, 3, 4, 5. Breathing in. Thinking of the pelvic floor. 2, 3, 4, 5. Breathing out. Thinking of the kidneys. 2, 3, 4, 5. Last one for 6. Breathing in. 1, 2, 3, 4, 5, 6. Breathing out. 1, 2, 3, 4, 5, 6. Breathing in. 1, 2, 3, 4, 5, 6. Melting down. Breathing out. 2, 3, 4, 5, 6. Breathing in. 2, 3, 4, 5, 6. Breathing out. 1, 2, 3, 4, 5, 6. And now just coming back to your regular breathing pace, whatever is comfortable for you. Bringing your mind to the kidneys, the bladder, and the pelvic floor. Breathing in, energizing those areas. Breathing out, melting down into the floor. Now thinking of Dantian, just that lovely breath, smooth, soft and silent, in and out of the lower abdomen. Bringing the hands together in front of you and rubbing the palms until they get really hot. Placing the palms of the hands over your eyes, fingers facing upwards. Feeling the heat from your palms traveling through the back of your eyes into your mind to nourish it. And then giving your face a little massage to bring yourself back into the room, slowly and gently opening your eyes. And if you're lying down now, in order just to take the pressure off your back so you don't strain it, bend the knees if they're out in front, if the legs are straight out in front of you, so that the feet are flat on the floor. Roll onto your side. Stay there for a moment. And then use both hands to push yourself up to a sitting position. Bringing the feet around and gently coming back to sitting. So never come out of that lying down position too quickly, because you'll make yourself dizzy and you might strain something. So it's always nice to come out of any position as slowly as possible. So that's a simple breathing exercise where we're paying attention to the kidneys, the bladder, and the pelvic floor area, just to bring a little bit more chi into that area, to encourage the flow of chi through that area, but also to calm the mind and to calm the nervous system, which is often associated with urinary or bladder incontinence. So I hope you enjoyed that, and it's something that you can easily practice when you go into bed at night time.